Uh, the idea is something that came to me. I started not in medicine, but in comedy. I was 19 years old and working on an American television show called SNL, Saturday Night Live. And then I went on and worked on a movie called Ghostbusters, and I was in the script department on both. And so I got to learn how to do comedy and how to write jokes and that sort of a thing. And for me, it was a bit of a saving grace because I had grown up in a very rough neighborhood in South Queens in New York City. And I was short and I was weird looking, and it was the only thing that would get me out of getting my ass kicked was the ability to make jokes. So it was a survival mechanism for me and many other people who go into comedy. So after working on these sorts of TV shows, I wound up making comedy films for the companies you see here, like HBO or Comedy Central or Showtime and CBS and PBS, all American networks. HBO, I know, is quite international as well. So um, I did that. And by doing that, I segued into making comedy films for the internet and then for mobile phones. And because I was the first one to be doing that in the early 2000s, that got me positions as an adjunct professor at the University of Southern California, Los Angeles, UCLA, Pepperdine, uh, Chapman University, most importantly at the University of Southern California at USC, which is a pretty well-known institution. And when I would talk to my students and coach them on the making of their short films, which were almost exclusively comedies, I would say that there needs to be something more important to what you do. You can't just have your comedy films play on YouTube and be disposable entertainment. There should be more meaning to it. And then I remembered that when I was working at Saturday Night Live, my dad was dying in a hospital of cancer nearby. And I wished that while I was working on that comedy show, that I could bring that so-called medicine to my father's hospital room. And the same thing many, many years later when my stepfather died in a hospital, or then when my youngest brother passed away. I wished again that I could bring comedy to them. And this was very, very important, not just for me, but because as you see here, in the United States, we have failing health rates. We have mental health challenges like the one that Dr. Reynolds just spoke about, substance abuse crises. We've killed more than 1 million Americans with opioids. That's more than we lost in all our foreign wars put together. Happiness records at record low, slumping life satisfaction, that sort of a thing. So our mission is to use laughter to improve the physical and mental health of anyone suffering, because pretty much everybody enjoys laughing. There are a few exceptions to that rule. So uh, I'll talk later about the evidence of 400 studies showing laughter improves wellness in one way or another. And here's just three studies from UCLA, from the Mayo Clinic, and other sources. So let me pull up these studies. This was by a Dr. Ronald Burke, who's now on our advisory board. And Dr. Burke identified 400 of these studies. He's a professor emeritus from Johns Hopkins, a well-respected American medical school. And so he founded that there were 400 studies all around the world that showed that laughter, in one way or another, helped you physically, right? And so I started by putting a channel of comedy videos onto the TVs at Cedars-Sinai Hospital, at Kaiser Permanente, also in Los Angeles. And we found that that was interesting, but not great because, frankly, it didn't produce any data. So we knew that we needed to create data. So we created an app. There's a picture of the app being used at USC Norris Cancer Hospital. And the app is very simple. It basically shows you comedy videos here. Um, Sorry, it asks you to take a survey on your subjective physical health. It has assessments like the PHQ-9 and the GAD-7 that I know Dr. Reynolds is familiar with. And then after you take that survey, we show you different types of comedy, sketch comedy, classic TV comedy, stand-up comedy, funny animals, or in this case, funny babies. And once you look at the funny babies or whatever comedy, for about 20 minutes, we ask you to do another survey to get your status at that time. So the first study that we did at USC showed that we lowered healthcare provider stress by 94% in 60 minutes. But since no healthcare provider has 60 minutes free until after they retire, we tried it again at Chapman University, where we were able to lower stress for those healthcare providers by 13% in only 3 minutes, which is still statistically significant. Um, and we weren't alone. There are many, many studies that I talked about, those 400 studies. Here's a really good one. This one is humorous and adjunct therapy and cardiac rehabilitation. And basically, Dr. Lee Burke at Loma Linda University found that with two sets of patients, the first set watched half an hour of comedy a day. And after 6 months, they found that only 2 out of 24 of those patients had a second heart attack. Whereas so the patients who did not watch half an hour of comedy a day, they 10, 10 of them had a second heart attack. So 2 out of 24 versus 10 out of 24, that's a difference of about 48%. So a huge difference just by watching half an hour of comedy a day. So we've assembled an amazing team of professionals in the business. There's Dr. Amitabh Mazumdar. He's our chief medical officer. He's one of the lead oncologists at the Oncology Institute. He's been a professor at USC and New York University. Our CEO is Scott Jensen, who has led content and innovation for companies like Viacom and Nokia. He was one of the leading forces in the Weather Channel app that we all use now today. Dr. Sandra Sufel has raised $4 billion in medtech, and she is an MD who was running a wing of Scripps Hospital by the time she was 30. Rick Barnett, CEO of 5 hospitals, Jeffrey Gurian, professor at NYU, dental school, dentist, and well-established comedy writer in New York City and comedian. And then you may have heard of Dr. Patch Adams. He was the subject of a movie that starred Robin Williams in the 1990s. And you've probably heard of Robin Williams, so maybe you're old enough to have heard of Dr. Patch Adams, who he portrayed. Uh, there's Lieutenant Colonel Robin Johnson, an American hero who used comedy to not only heal herself after 4 tours of duty, but formed something called the Best Medicine Brigade of other soldiers who had also suffered PTSD. And they found that by not just watching, but by performing stand-up comedy, it was very healing to them. And now she's a fellow at the Stanford Military Institute called the Hoover Institute. And she's touring the world, literally, for the US, talking about the benefits of comedy. And so, yeah, so that's our people. Um, so these are some of the accolades that we've won. We are endorsed by the Medical Society of the State of New York. We're a USC official incubator company. We won the Charm Health Award for digital innovation, the Health 2.0 Award for Best Company, and the Association of Applied and Therapeutic Humor Best Company Award as well. So we're on our way. And the way we got here was by doing studies. So I showed you the study at Chapman University. I told you about the study at the Institute for Genetic Medicine at USC as well. But now let me show you the one from USC Norris Cancer Center. So this one does viewing comedy videos improve the patient experience? We use this with oncology patients at USC Medical Center. And the results were pretty amazing. I don't have all the slides from it, but basically, we were able to lower stress and pain in those patients by over, sorry, in over 90% of patients. Stress and pain over 90% of patients. From there, we wanted to see by how much. How much are we lowering stress and pain? So this study was done at A.T. Still University by Dr. Joseph Cohen, and he's head of pain management there. And this study basically showed that in 4 weeks, we were able to lower pain for chronic pain patients on the McGill pain scale from over a 10 to just about 4. So that's a 60% reduction in pain in only 4 weeks just by watching 20 minutes of comedy a day. That's pretty impressive. So our our uh, uh, audience right now is we want to provide this application, this solution for healthcare providers and for their patients. So you, kind folks, are the audience. So I hope that you can use it. So if you write to me or call me or WhatsApp me or text me, I will find a way to get you the app so that you can use it and you can give it to your patients. And let's see. Here are some of the articles on health as on laughter as medicine from around the country. And this is stuff that you already know. Laughter includes laughter increases positive versus negative neurochemicals in the human body. We're increasing serotonin, dopamine, and endorphins. We're lowering cortisol and adrenalines. You all know that. That's pretty basic. But the results of that are that it benefits all these systems that you see on screen here. Now, the trick to this is that only positive comedy works. Only positive comedy does this. So you actually need human beings, and we have a team of 3 curators who will go and make sure that the comedy is positive. It's positively based. We make sure it's not political. We make sure it's not stressful. We make sure there's no nudity or cursing or violence in the comedy videos. They're not basically not stressful. They're pleasant and funny, and only humans can do that. So that's what our team does. Now, the question that we get most often is why would I not just watch television or TikTok or YouTube? They have lots of funny videos on there. Well, TikTok is not your friend. YouTube is not your friend. YouTube is not a health app. YouTube is there in reality to get you to watch as much YouTube as possible. YouTube is there to keep you from watching TikTok, and TikTok is there to keep you from watching YouTube. And how they do that is stress and oftentimes rage. That's what they're doing. They're trying to stress you to get you enraged, to get you sad, to get you um, curious about doom scrolling. You've all heard of doom scrolling. Well, that's their favorite way to keep you on there. And their favorite way to get you to watch long videos about how the earth is about to end tomorrow and how the other side is responsible for it and how we all have to do something about the other side. And what do? We watch another video. So that's why you can't just watch comedy videos on TikTok or YouTube because they're not there to make you laugh. They're there to take money from you. They're there to sell you ads. That's what we do by showing you positively based humor without commercials for your health benefit is different than watching it on TikTok. So here's my advice. If you want to use this yourself, if you want to self-medicate, here's my tips. First of all, be careful. Use social media videos like YouTube judiciously. A little is fine, but a lot can hurt you. It's like a glass of fine wine, right? One glass is great. Drinking an entire bottle, probably not so great for you, right? Um, like life, it's better shared with friends. You're 7 times more likely to laugh in the presence of other people. So share humor, watch it with others, Send a funny video to a loved one, for example. Have them send one to you and then talk about it. Share your experience with it. Just sending somebody a funny video and then letting it fall into the void is not so as great as sharing the experience. Or if you really want to share the experience, go to comedy clubs and laugh with 100 other people at a time, or watch a sitcom or a movie with friends or family. Uh, they say laughter is the best medicine. As we say, other than actual medicine, LaughMD may be the best companion to medicine. So that's our show. Thank you very much. I'm Professor Frank Chindamo.